Good morning, class. Welcome to week 6 of Nursing 301. This week we're going to cover chapter 10, which is infancy and childhood. And we're going to start with human growth and development. So growth is, of course, a change in body size and structure. Development is a change in body function. And also genetic factors. The hereditary characteristics inherited from parents and passed on to another generation. There are 3 major influences on a child's growth and development. It is heredity, nutrition, and environment. The 3 major influences on a child's growth and development is heredity, nutrition, and environment. Characteristics of human growth and development. This is all on page 106 in your book, is when it starts. Orderly sequence. Growth and development occurs in an orderly sequence. They have to accomplish a simple task before they attempt a more complex task. And growth and development occur in simple to complex. They have to sit before walking and babble before speaking. Cephalocaudal. They develop head to tail. They lift their heads before they sit. Cephalocaudal. Head to tail. They lift their heads before they sit. Proximal distal. Center to the outside. They roll over before they grasp small objects. Proximal distal is they roll over before they grasp small objects. Inclusive. It is the multifaceted aspects of growth and development are inclusive and holistic. It involves a child and family in the physical, social, and emotional or psychosocial environments. Basic developmental skills. Physical growth is a change in the body size and structure. Psychosocial development is the ability to interact with others and to form relationships, to cooperate, and to respond to the feelings of others. Cognitive and motor abilities includes cognitive, language, gross motor, and fine motor. So with the cognitive motor abilities, cognitive is your ability to think, learn, and understand and solve problems and remember. Language is the ability to communicate by speech or body gestures. Gross motor, of course, is a use of large muscle groups, where fine motor is a use of smaller muscles in conjunction with the large muscle groups. And that occurs such as like holding a cup, using a fork, buttoning their shirt. And all aspects of growth and development are influenced by each other or are interdependent. And this here is just a picture of how they grow, head to tail. All right, a little glitch there. So developmental milestones and delays. Developmental milestones is accomplishing skills and abilities in predictable patterns within general age-specific timeframes. For their first smile, their first step, their first word. Developmental delay occurs when a child does not achieve predicted developmental milestones within acceptable patterns. And it is very important to have an understanding of normal behavior as it's necessary so that you can recognize abnormal behavior. So you have to be able to have an understanding of normal behavior before you can recognize abnormal behavior. And regression is a child's behavior may go backward to that of an earlier stage of development. And regression can occur during an illness. It can occur during maybe they're hospitalized for a surgery, but children sometimes will regress to an earlier stage of development. So, anticipatory guidance. You educate caregivers about expected changes. They have concerns regarding behavioral and developmental issues. Caregivers express worries that their children are not behaving like other children of similar age. What do we want to do as nurses? We want to communicate that normal growth and development occur within a wide range. And the caregivers need to be able to recognize each child's unique natural abilities. We need to help caregivers understand the needs and problems of children. And nurses should also help the caregivers and the children work towards increased abilities, self-knowledge, and self-discipline. The challenge is to help children develop so that they maintain their eagerness to learn throughout their lives. Influences on growth and development. Heredity is a biological process responsible for transferring physical traits from one generation to another. Genetics is the study of heredity in biology. It's sex, race, skin color, eye color. Temperament, combination of an individual's characteristics, the way a person thinks, behaves, and reacts to the environment. Nutrition is the selection, preparation, ingestion, and assimilation of foods by the body, major factor in the body's ability to resist infection and combat diseases. Nutrition does affect growth and development. Environment. All conditions and factors surrounding the child influences growth and development. Example as like their housing, the neighborhood, the number of siblings they have, placement in the sibling order, and the amount of health care available. What also influences child development is religious practices, ethnicity, location of birth, their socioeconomic level, and parental use of alcohol or drugs. So Erikson's psychosocial development focuses on the psychosocial and environmental aspects of personality as a person progresses from birth to death. Every stage of development contains the psychosocial challenge. The psychosocial challenge is a critical period during which the person must deal with a major life change. If they fail to meet the challenge, the individual has difficulties in achieving the next level of development. Every stage of development contains psychosocial challenge, and this challenge is a critical period during which the person must deal with a major life change, and if they fail to meet that challenge, the individual has difficulties in achieving the next level of development. And this is on page 108. So you might want to highlight that statement, underline it. It is under Erikson's psychosocial development. The main points of Erikson's theory are each stage of development contains a psychosocial task or crisis. This challenge is a critical period during which the person must deal with a major life change. In each stage of development, a significant person or group exerts a lasting influence on the ongoing development of the child. So, infant caregiver. You know, who is that most significant person to the infant? Usually it's the mom and the dad. Adolescents, it's more their peer group. So for infants, it's the mom and the dad. For adolescents, they're influenced more by their peer groups. Necessary accomplishments. Infants must develop trust, Toddlers learn appropriate behaviors. Preschoolers learn rules and regulations and establish independence. And school-age children learn to get along with others. Infants, they have to develop trust. So every stage of their development, for the infant, they develop trust. Toddlers, they learn appropriate behaviors. Preschoolers, they learn rules and regulations and establish independence. And school-age children learn to get along with others. Appropriate virtues are beneficial, challenging, and exciting characteristics that emerge as individuals successfully accomplish tasks of that developmental stage and successfully resolve the psychosocial challenge. And ways to help the children. As parents, we need come up with ways to help the children succeed. So remember, for Erikson's, every stage of development contains the psychosocial challenge, and this challenge is a critical period during which the person must deal with a major life change. And for an infant, the significant person to an infant is usually their mom and dad. And for adolescents, it's the peer group. Piaget's cognitive development. Cognitive, of course, is knowledge, understanding, or perception. Development is a continuous progression of 4 principal stages. The 4 major levels of cognitive development are I can say that word. Sensorimotor, pre-operational, concrete operations. And concrete operations, they exhibit reversibility, seriation and conservation of matter, and formal operations. So the sensory motor is up to age 2. They learn by touching, tasting, and feeling. They learn to control body movements. They begin to associate cause and effect, such as you touch the toy. Touching a toy can cause it to move. And object permanence, know that an object seen in a particular spot but temporarily hidden from view continues to exist and will return to view when uncovered. Pre-operational is ages 2 to 7. They investigate and explore their environment. They interpret experiences from their own perception. Concept of quantity is distorted because children ages 4 to 7 think that 4 ounces of juice in a small glass seems to be less than that same amount in a large glass. Concrete operations, ages 7 to 11. Concrete operations is ages 7 to 11. They develop the ability to think in abstract. They can solve problems, classify and organize information within their own environment, and they begin to consider another person's point of view. So remember, concrete operations is ages 7 to 11, and they begin to understand another person's point of view. An example of that would be, Susie would be sad if I ripped a page in her new book. So concrete operations, they begin to consider another person's point of view, and they can understand the difference between volumes and weights. They can understand the difference between volumes and weights. Informal operations is after age 12. Informal operations, they can think in abstract. They have complex problem solving which includes the ability to understand a double meaning of jokes and words. They can discuss theories, philosophies, and develop conclusions from facts provided. Formal operations, they can think in abstract, whereas concrete operations, they begin to consider another person's point of view, and they can understand the difference between different volumes and weights. Roles of play in childhood development. Play with other children encourages peer cooperation, interaction, and sharing. They learn about their environment using all 5 of their senses, and play is important to a child development because they learn through play. Play enhances their fine and large muscle coordination and strengthens muscles. Play also enhances awareness of fairness, rules, and regulations of social situations. Solitary play. Infants play alone with their own toys in the same area as others, but without interaction. Where parallel play, 2 children play side by side with the same or similar toys, but do not interact with each other or the other's toy. So solitary play, they play alone with their own toys, and they may play in the same area as others, but there is no interaction. Where parallel play, 2 children play side by side with the same or similar toys, but do not interact with each other or the other's toy. Communication is, of course, the ability to exchange information. The verbal exchange with infants and young children, language, sounds, their cries, writing, handwritten or manufactured, symbols or signs, colors, body language, smells. Nurses, when you communicate with children, know the child's stage of development and be aware of nonverbal gestures. Anxiety, stranger anxiety. Stranger anxiety is a form of distress related to survival instincts that occur when children are exposed to individuals who are unfamiliar to them. Typically starts between the age of 7 to 9 months. Possible issues promoting anxiety could be their temperament. It may be their past experiences with strangers. Could be related to a new environment, presence of the primary caregiver, their interaction of strangers. It could also be related to the number of caregivers they have or their age. Separation anxiety begins at about 7 to 9 months, but it is not uncommon in toddlers. So, stranger anxiety, their temperament. Some children are more fearful than others. Their past experiences with strangers. They only want to be picked up by their primary caregivers. New environments. They become accustomed to routines and physical surroundings. Presence of primary caregiver. They will tolerate the unknown if their primary caregivers are present, or the number of caregivers. If cared for by a number of caregivers, they're usually able to tolerate a wider circle of people. Interaction of strangers. They can be sensitive to strangers, verbal and nonverbal behaviors. And age can discriminate more effectively between threatening and non-threatening environments. Infancy is a period from 1 month to 12 months of age. Their physical growth by the end of the year, they weigh about 3 times their birth weight. Remember, they weigh about 3 times their birth weight. They increase their birth height by about half. They grow about 10 to 12 inches in that first year. And they have 6 to 8 deciduous teeth. Their fontanelles or soft spots, their posterior closes by the end of the second or third month. Their anterior usually closes between the ages of 12 to 18 months. So remember, infancy is a period from 1 month to 12 months of age. A neonate or newborn is up the first 28 days. Psychosocial development. Infants must learn to develop trust, and they expect their needs to be met immediately. Establishment of trust in primary givers. If they do not establish the trust, the later challenges of autonomy and initiative will be delayed. Changing families and role of caregivers. They usually have a variety of caregivers. They may need outside support systems depending on the family's situation. Bonding is of vital importance for infants. Touch contributes to a baby's ability to thrive. Attachment is an interactive process, relies on particular participation from both adults and babies to be successful. And accomplishing tasks. Infants must learn to develop trust, they expect their needs to be met immediately, and routines help infants establish feelings of trust. So remember, routines help infants establish feelings of trust. Cognitive and motor development, it depends on physical maturity and environmental factors. So on page 111 of your book, when babies are 6 weeks old, they begin to make purposeful movements and stop crying when they're picked up. By 8 weeks, they can stare directly ahead for a short time. Babies smile, babble when spoken to, and follow lights within view. They will turn their head towards sound and can differentiate between pleasant and unpleasant noises. They cry to signal their needs. They will pay attention to their parents' voices. And usually at this stage, they will sleep about 18 to 20 hours a day. By 3 months, babies can reach for and grasp objects. They laugh, squeal, and look at items for several seconds. They can follow a moving object with their eyes. And between 2 to 3 months, they develop a social smile. So at 3 months, they can reach and grasp objects, laugh, squeal, and look at items for several seconds. At 8 weeks, they can smile, babble when spoken to, and follow lights within view. Areas of concern is feedings. Usually at this point, they're breast milk or formula. At 4 to 6 months, you can give them iron-fortified infant cereal, given with a spoon, not a bottle. Most generally, I've seen it now more recommended that you start them at about 6 months with iron-fortified infant cereal. Avoid typical allergenic foods such as dairy, citrus fruits, tomatoes, chocolate, wheat, seafood, and eggs. Bottle mouth. Bottle mouth can cause erosion of tooth enamel. Deep cavities and tooth loss can result from the prolonged contact of milk and juice sugars with emerging teeth. Weaning occurs according to each child's internal schedule. Sucking provides comfort and relieves tension and anxiety, can cause problems if done for long periods of time. And what is a very handy object for infants? Their thumb. Daycare can be a very difficult decision for parents. Cost is a factor and safety is vital. So, daycare, it's always that question a lot of times. Sometimes it's not for some parents because they have to go back to work. But finding the correct daycare for their infant. Toddler phases. Their personality begins to emerge. This phase encompasses age 1 to 3. Their physical growth is not as rapid as in an infant. They gain usually about 5 to 10 pounds annually, and they grow about 2 to 3 inches per year. And they make great strides in their physical and motor skills. Their attention span is pretty short, usually 5 minutes, 10 at the most. Remember, and I don't think this information is in your book, but their attention span is very short. And it's usually about 5 minutes, maybe 10 minutes at the most. Their fine motor skills continue to develop, and they can drink easily from a cup that has a spout on it. Sippy cups. Psychosocial development. The challenge is autonomy, independence versus shame and doubt. They begin to establish independence by walking by themselves, self-feeding, playing, and speaking. Virtues, self-control and willpower, which allows them to make simple choices. And discipline, you have to have consistent guidelines and discipline in this age group. I think it's more important to have those consistent guidelines, and they get used to that. Some children are a little more challenging than others at that age group. Cognitive and motor development. Intellectual and social development becomes more evident as they grow physically. They have increased motor skills, and their verbal skills continue to improve. Their social contacts broaden. Toddlers will play next to their playmates rather than with them. And by age 3, routines become more flexible, and they have increased motor and language skills. Areas of concern. Toilet training requires patience and encouragement. Accident prevention. Safety issues are important concerns for all ages. They require constant supervision. Accidents, most generally the accidents involve motor vehicles, followed by drowning, burning, poisoning, and falling. Setting limits. Simple, consistent guidance is important. They may be a thumbsucker and need a security blanket. Sometimes those two things may reflect insecurity or loneliness. Temper tantrums. Temper tantrums are more common when children are hungry, tired, frustrated, or feeling neglected. If you're in public, they should be physically removed from the situation and alerted that behavior is unacceptable. But temper tantrums are more common when they're hungry, tired, and frustrated. Sleep habits in the family bed. You want to promote regular sleep habits. And the family bed, what works for one family may not work for others. Separation anxiety, you want to provide reassurance that caregivers will return. Preschoolers, ages 3 to 6 years. Curiosity during this phase is rampant, imagination is vivid, and they may exhibit aggressive behaviors. Physical growth, they may gain less than 6 pounds per year. Usually it's about 3 to 5. They may gain 3 inches annually until school. They have a steadier walk. And this age group, 3 to 6, can state their full name and age. Age 3 to 6 can state their full name and age. And boys are typically thinner than girls in this age group. Psychosocial development, inquire initiative. You know, their favorite words are why and how. Their social circle includes friends and adults, and they make up simple games by age 3. The challenge is to acquire initiative, to be able to do things without having to be told. And their virtue is sense of direction and purpose. Cognitive and motor development. They have more defined motor skills by age 3. They have a desire to be independent and to do things on their own. They have a great desire to accomplish goals. Parental supervision is essential. Safety issues are still a concern with this age group. They're comfortable with themselves and their relationship with others by age 5, and they have magical thinking. Sometimes some children will have imaginary playmates. Areas of concern is trip over that word. Sibling rivalry. They're jealous. Nursing care, we have to be aware of the child's coping skills, especially their emotional skills. Reassure family adjustment phases are normal. Phobias and nightmares. Phobias, they may have fear of the dark. Nightmares, they're not uncommon. As nurses, we need to provide the caregivers reassurance, discover and discuss the causes of fear and nightmares. Masturbation, teach to practice in private. It is more effective than punishing or shaming. Enuresis is bedwetting. It's common. It's usually not diagnosed as a problem until the child is age 5 or older. And it can be a result of a physical or emotional disorder, and it may be hereditary. School age encompasses the ages up 6 to 10. 6 years of age, they're active, they have limited attention span. By 10 years of age, they enjoy solitary activities. Their physical growth is slow and steady. They lose their deciduous teeth and their permanent teeth are. Psychosocial development, the challenge is developing a sense of industry. Independence is important to them, and they enjoy personal and group activities. Virtues is sense of belonging and feelings of competence and self-worth. Self-development and reaching out beyond family are signs they are maturing. Their cognitive and motor development, they become increasingly independent. Fitting in with their peer groups becomes very important, because the influence of peers takes on more acceptance and importance than does that of the primary caregivers. They learn to abide by rules, Reasoning and conceptual powers expand. They have the ability to think in abstract, and they complain about tasks that involve responsibility. And areas of concern for this age group is sibling rivalry, which is natural. You want to treat each child equally and fairly. Responsibilities. They need, clean their bedrooms, setting and clearing the table, take out the trash, walk the dog. And sex education, make sure children receive the correct information. If the parents don't provide it, a nurse is another great source for receiving that information. So that is the end of chapter 10. But just a quick review. The three major influences on a child's growth and development is heredity, nutrition, and environment. Cephalocaudal is head to tail, and they can lift their heads before they sit, and they sit before they stand. Proximal distal is center to outside. They roll over before they grasp small objects. Regression. A child's behavior may go backward to that of an earlier stage of development, and that may occur during illness. Erikson's psychosocial development. Every stage of development contains a psychosocial challenge, and this challenge is a critical period during which the person must deal with a major life change. Piaget's concrete operations. They begin to consider another person's point of view. Susie would be sad if I ripped a page in her new book, is an example. They can understand the difference between different volumes and weights. Formal operations, they can think in abstract. Solitary play is infants play alone with their own toys without interaction. Parallel play. Two children play side by side with the same or similar toys, but do not act with each other or the other's toys. Infancy is a period from 1 to 12 months of age. Routines help infants establish feelings of trust. At 3 months, they can reach and grasp objects, laugh, squeal, and look at items for several seconds. At 8 weeks, they can smile, babble when spoken to, and follow lights within view. Feedings, iron-fortified cereal that can be given between the ages of 4 to 6 months. Bottle mouth causes erosion of tooth enamel. And let's see what else I got here. Their attention span for toddlers is like 5 to 10 minutes at the most. Normally, it's about 5 minutes. The attention span for a 1 to 3-year-old. For 3 to 6 years old, they can state their full name and age. I'm trying to turn a page here and it's not wanting to turn. And that is the end of chapter 10. You guys have a great week. I'll talk to you next week.